Picture this. You're home alone when suddenly your vision blurs and one side of your face starts tingling. Would you recognize these as stroke warning signs? Could you save your own life when every second counts and there's no one around to help? Welcome to Inspired Living. Today, I'm revealing 5 crucial survival strategies for handling a stroke emergency when you're completely alone. If someone you care about could benefit from this knowledge, hit that like button and share this video right now. Here's a sobering reality. Strokes occur every 40 seconds in America, and they don't wait for convenient moments. They can strike while you're driving, shopping, or relaxing at home. Traditional medical advice assumes someone else is always there to help you, but millions of people spend significant time alone, particularly seniors who face elevated stroke risks. If you've dealt with a stroke while alone, please share your story in the comments. Your experience might save another viewer's life. And if you're new here, subscribe to Inspired Living because we deliver content that can revolutionize your health and safety. Most people approach stroke survival backwards, focusing on what happens after someone else identifies the emergency. I'm flipping that script. This information comes from emergency physicians and neurological specialists who witness stroke outcomes daily. These are field-tested techniques that determine whether someone survives with full function or faces permanent disability. Here's my plan. First, I'll teach you how to identify stroke indicators when your brain fights against clear thinking. Then I'll show you precise communication methods for getting help when speaking becomes difficult. Next, I'll reveal the positioning technique medical professionals consider essential. Fourth, I'll explain how to prepare for emergency responders. Finally, I'll share the documentation system that influences your treatment and recovery. Let's start with strategy number 1. Detecting warning signs instantly is your primary defense. But here's the challenge. Strokes actively interfere with your thinking, and your first instinct will be dismissal rather than action. Your mind searches for innocent explanations like tiredness or stress. Use the FAST assessment on yourself. For your face, look in a mirror or phone camera and try to smile. Does one side droop or feel numb? For arms, extend both arms forward, close your eyes, and hold for 5 seconds. Does one arm drift downward? For speech, say, "Today is beautiful," aloud. Are words slurred or garbled? Watch for these additional warning signs. Sudden weakness on one side, immediate confusion, abrupt vision changes, instant dizziness or balance loss, and severe headache without cause. If you're experiencing any of these symptoms right now, stop this video and call emergency services immediately. For everyone else, please hit that like button. Strategy number 2 is contacting emergency services effectively when stroke symptoms impair your communication. Dial 911 immediately, regardless of speech difficulties. Emergency dispatchers are trained to recognize stroke communication problems. Say "stroke" if possible, but stay on the line even if words won't come out. Most systems can trace your location without verbal confirmation. When standard dialing becomes impossible, use voice controls saying, "Hey Siri, emergency services," or press your power button multiple times to activate emergency features. Use medical alert devices or smart speakers saying, "Alexa, I need help." When connected, state you suspect a stroke, provide your address, mention if your door is locked, and describe your symptoms and timing. Request transport to a certified stroke center when possible, as these facilities have specialized protocols for rapid stroke treatment. Before we continue, subscribe to Inspired Living if you haven't already. We're building a community that prioritizes proactive health preparation. Strategy number 3 focuses on accessibility preparation, frequently overlooked but crucial for eliminating response delays. After calling for help, ensure responders can reach you efficiently. Unlock your door immediately, if safe to do so. Emergency teams may need to break through locked entries, wasting precious time. Position yourself near your main entrance if possible. Activate exterior lighting, open window coverings, and make your location obvious. Gather essential information if you can: medication lists, medical history, and emergency contacts. Prepare your space by removing obstacles from pathways, shutting off cooking appliances, and containing pets to prevent interference with emergency procedures. Strategy number 4 involves protective positioning while waiting for help. Your body position significantly impacts your condition. When experiencing weakness or dizziness, lie on your side instead of standing. This reduces fall risk and prevents additional injuries. Use the recovery position, lying sideways with your upper leg bent and lower arm supporting your head. This maintains clear breathing passages. Elevate your head slightly with a pillow, which may help reduce brain pressure. Critical safety rule: avoid eating or drinking anything. Strokes can compromise swallowing reflexes, creating choking hazards. Remove restrictive clothing around your neck, chest, and waist. Stay calm and focus on steady breathing while waiting for help. If you're finding this valuable, like this video and comment which strategy surprised you most. Strategy number 5 is symptom documentation and tracking, information that determines your treatment options. While waiting for help, record when symptoms started and how they're changing. The precise timing of symptom onset is crucial because effective treatments must be delivered within specific time frames. Document the exact time symptoms began, which appeared first, how they've progressed, and any medications you've taken recently, especially blood thinners or blood pressure drugs. Use your phone's voice recording if writing is difficult. Set phone alarms every few minutes as consciousness monitoring and backup assistance. The details you capture directly impact your treatment protocol at the hospital. Surviving a stroke extends beyond emergency response. Hospital treatment focuses on restoring blood flow as rapidly as possible through clot-dissolving drugs or mechanical procedures. These work best within hours of symptom onset, proving why rapid response is essential. Recovery involves physical therapy, speech therapy, and occupational therapy. Your brain has remarkable adaptability, and many survivors recover substantial functionality with proper rehabilitation. The best strategy is prevention. Manage risk factors like high blood pressure, cholesterol, diabetes, smoking, and excessive alcohol. Regular checkups identify risks before emergencies occur. For high-risk individuals or those living alone, consider regular check-ins with family, medical alert devices, smart home monitoring, and stroke risk assessments with your doctor. Time remains the most critical factor in stroke survival. Every preparatory step and minute saved translates to preserved brain function. By mastering these strategies, you maximize your chances not just of surviving, but maintaining quality of life. Were these strategies new to you? Do you have experiences that could help our community? Share in the comments below, because shared knowledge saves lives. If this was helpful, type yes in the comments and subscribe to Inspired Living with notifications on. We consistently share content to enhance your health and safety. Check out our other emergency preparedness videos too. The more prepared you are, the better you can handle any health crisis. Thanks for watching, and remember that investing in your health knowledge always pays off. Until next time, keep living inspired.